Begin our meeting today, Wednesday, November 16th, Education, Environment, and Sustainability meeting. Can you call the order, Madam Clerk?
Calling the roll, Ms. Simon.
Here.
Ms. Brown. Here. Mr. Jones.
Here.
Mr. Shrine. Mr. Shrine is absent. Mr. Brady.
Here.
There is a quorum. Also like the record to reflect that Councilman Miller is in attendance.
Thank you. Any public comment?
No, Madam Chair, no one is signed in.
We have minutes from November 2nd. I think most of us were here. Can I have a motion to approve the minutes?
So moved.
All in favor? All in favor? Aye.
Aye.
Okay, minutes approved, adopted, one abstention. Okay, so we have one matter referred to committee, 2016-0220. Madam Clerk, can you read that?
Resolution number 2016-0220, authorizing an agreement with Educational Service Center of Cuyahoga County in the amount not to exceed $1,554,391 for fiscal and administrative services for the Help Me Grow Bright Beginnings program for the period 10/1/2016 through 12/31/2017.
Thank you. Okay, we have two people here to speak on this, our Director Dorman and Bob Stade.
Yes, thank you very much. This contract is for the new period of time for our very important Bright Beginnings home visiting program that is delivered by Help Me Grow. The timing of the contract is allowing us to move them to a calendar year, eventually will be now regular calendar year contract. As you know, the county has shifted how funding will be working. We are I think we're really especially proud of the program right now because of some improvements that have been made, and we're seeing the results of that in the last quarter. So, as you know, we partner with Case Western Reserve to evaluate all of our programs, and we take that evaluation very seriously. We are not satisfied with the status quo. In the last evaluation that was done, what we saw was a large number of families who came into the program were exiting by the second visit. Actually, half of the families were coming in, and by visit number 2, after that, they were gone. So you can't impact those folks if they're gone. So we really sort of read them the riot act on this and said we need to see significant improvement in this program's operation, or, we have to reevaluate funding. They took that to heart, went back and really made some significant changes to the program based on the evaluation. So one of the things that we think, and we all have, obviously put our heads together, what's going on. There was enormous amount of paperwork in the first few visits. The parents as teachers model has paperwork. We have paperwork, there's accountability. But we were worried that, 2 visits worth of bureaucracy, and some of the families are voting with their feet, and we understood that. If you ever go through, medical appointments where you keep filling out stuff. So they've shifted the model. So the first visit is now a sort of a sample of what you'll get if you enter the program with the child development information, the parenting information, et cetera. And it's very light on the paperwork. So that was one change they made. Another change was mandating a reduction in the caseloads for the agencies they contract with. So Help Me Go contracts with 3 agencies to deliver the services. And in their contract, they mandated, we want 25 maximum, and we want you to see families twice a month. And they tied payment not to numbers of families served. They restructured how they pay to a per visit model. So we now have the first quarter, and there's some other changes too with we've added a social media component and someone who really is in an ongoing fashion in communication with families through a closed Facebook group. So it was a full court press of how we were both changing the way the program was delivered and the way the agencies were being compensated. Did I get everything with that, Bob? Okay. So the first quarter numbers came in, and both the director of Help Me Grow, Karen Mincer, who couldn't be here, she's at the National Home Visiting Summit in DC, or they could be bragging about their own results, but I'll brag on their behalf. So what we're seeing is a really remarkable change. So what we're looking at now is for families that are now from the previous quarter. So this change has been in effect for a while, but now we're looking at just the first quarter of who was in the program. So the average length of stay now is 19 months in the program. It used to be for average length of stay a year, which was honestly what the average is nationally, which is still not good. So everyone's struggling to some degree, I should say, with keeping families engaged. So the average length of stay in all home visits, so now we're up to 19 months, which we think is great. The average number of visits families have gotten, which is really in some ways more important than the months, because maybe you had 2 visits in it, right? So it's 24 now. So we're seeing families really get a dose of the program that can make an impact. 62% of all the exited children who were 3 at the time they exited the program did enroll in preschool. So we're getting most of the kids now. We're working on making that a reality. Now, the result of families staying in the program longer and reducing the churn is we now have a waiting list because slots don't open up. So if there's a downside, is that we have a waiting list right now of 81 families. So the next step, of course, we're going to be looking more at child outcomes and watching to see that these statistics and metrics are maintained. But we're really delighted because for me, this is what we're supposed to do. We're supposed to look at a program, look at it with look at it in a way that's going to use the data to help it improve, but not brush anything under the carpet, and really work to make the program better. And I think this is a great example of evaluation, not a stick, but a motivator, and seeing the program really step up to the plate. So, is there anything else you want to add on that? I don't think so. Okay. So you may have questions or...
Any questions? Councilwoman Brown.
Thank you, Madam Chair. The 3 agencies, did you identify those?
No, so that is Catholic Charities, it's actually St. Martin de Porres of Catholic Charities, Friendly Inn, and Ohio Guidestone.
One other question. Is this contract, this is an extension, or this is
our new contract. So I think at the last meeting where I wasn't present, there was an amendment to the prior contract. Now we're cleaning everything up, we're getting on target, and this is the new contract, which takes us to the end of next year, and then again we'll be on a calendar year basis, which is where we want to be now.
Okay, and is the dollars increase or about the same?
No, just it's the same.
Okay, thank you.
We have Council President, then Councilman Jones.
I missed this, but you mentioned that you were averaging 24 visits now. You were talking about the 19 months and the year.
Mm-hmm.
You said 24 visits, but I didn't hear you say how many visits had taken place. Is that up from what?
I don't have the average from before of how many visits they were. It was definitely much less on average. I'd be happy to get that for you. I know average length of stay used to be 12 months, and we're up to 19 months, and that's just from memory. I don't remember I'm sure it's a lower dosage. Just knowing that half of the families were gone after 2 visits, I'm sure it was much lower.
Well, if it's not too much trouble.
Yeah. Oh, no. That's easy to get. Yeah.
All right.
I'd be happy to get that. I do want to say, it's not to say that the 50% of the families in the past who stayed weren't getting a high-quality program, so don't misunderstand that. But we definitely, like I said, we have to make sure we're doing everything we can to maximize engagement
So
too.
you believe this is an improvement?
Yeah, well, right. I mean, the curriculum has stayed the same. We're using the Parents as Teachers curriculum. It's a nationally known, evidence-based, much researched, curriculum.
How quaint.
But it's the approach that you have to take with families. There's a lot more than just curriculum and how you engage high-risk families. Everyone continues to find, that's a challenge. So I think I think they found some of the keys to changing it.
All right, thank you.
Has this contract always been funded by Health and Human Services, or was there ever federal dollars, or?
So the way that this used to work was, so there still are state dollars that go to Help Me Grow for home visiting. That's a different program, and that was, so those dollars used to come through the county and through the central Help Me Grow site before it flowed out to the agencies. The model that we have, and the way that we have now. About 6 years ago, 5-6 years ago, the state shifted its model, saying that they wanted to be able to draw down Medicaid dollars to fund the program, and to do that, they felt they needed to have direct contracts with all the agencies instead of having it flow through the central site and through the county. There's still no Medicaid money. I ask about it when I'm in Columbus repeatedly. Are you ever going to try and do that again? Who knows now? But that never happened. But the change in the structure has remained. So these 3 agencies actually also have contracts directly with the state to provide the Parents as Teacher curriculum as well, and they bill the state also. We have nothing to do with that in a way, except that through the Home Visiting Collaborative, we know about it, we know they're serving families, but it's separate eligibility. So the Bright Beginnings program was really created when all that happened, and they really narrowed eligibility, which, by the way, they may even narrow more, and a much more of an emphasis because of infant mortality issues, which I know was the subject before this afternoon. They really want to focus pregnant and early parenting. So the Bright Beginnings program, because we're funded by the county, we're very flexible. So we'll take all the families who need home visiting but don't meet all the eligibility criteria for all the other programs. So that's what Bright Beginning really fills the void that would otherwise be there in the county for serving families.
Okay. And this contract started back in October 1, 30 days. Has there been money not expended? Are they waiting to be paid?
Well, the money keeps flowing. Yeah, the money keeps flowing. They will submit an invoice for October. They have actually the month of November to submit that to us. So we would expect to see that sometime by November 30th.
And has the agreement been with anyone other in the past, anyone other than Education Services Center?
No, that's the fiscal agent for Help Me Grow. Yeah,
Okay.
so that's why. Over the many years, agencies have come and gone, but right now, these are the agencies who have been providing the program.
Okay. All right. Thank you.
Sure.
Just quickly, could you say again the 4 agencies that are currently being funded?
Sure, there are actually 3. So
3.
it's St. Martin de Porres of Catholic Charities, Ohio Guidestone, and Friendly Inn. I could also say, although I think you've already heard about this, but Councilman Miller knows well, there used to be Children's Trust Fund dollars that flowed to support the program, and with the state's shift to the regional model, a different plan, et cetera, those dollars are not flowing to the program right now. Whether or not they may be successful with the RFP that will be issued soon, we can't say. So in a sense, they did take a funding cut because of that.
Councilwoman Brown?
Thank you, Madam Chair. The 81 families that are on the waiting list, how are we addressing that?
Right now, I think primarily through the this position, which is I'm not sure of her official title, Family Engagement Coordinator. This young woman named Frashik, what's Frashik's new last name? I'm sorry, Frashik got married recently. She used to be Frashik Austin, but it's an interesting story. So a number of years ago, Regina Brett did a column on this young woman who started a nonprofit called Lemons to Lemonade, based on her experience as a teen mom, a single mom struggling to raise her kids and get her education, etc. I happened to read about it and contacted Help Me Grow, and I said, I think we need to reach out to her and see if she would help us, because she's trying to engage families and she was using social media to do it. And I said, we need to step up our game, and look, here's someone doing it. To make a long story short, she's now worked for Help Me Grow for a couple years. She moved in full time. She's not married. She got her degree, and she has been fabulous. So she runs this closed Facebook group with Help Me Grow families to stay in touch, and she contacts families, and she runs the in-person parenting groups. So it's my understanding that when people are put on the waiting list now, which is a new thing for them, she's staying in contact and trying to keep the interest in the program, and that families could join the Facebook group or come to in-person groups while they're on the wait list. So there's a real effort not to lose those families, but it's always a risk.
And what's that window average for a waiting list, for a family on the waiting list?
5 weeks.
Any other questions? So just if you can just recap, maybe a synopsis of Help Me Grow and Bright Beginnings and home visits and what the 19 months would include, and differentiate between those two.
Well, so I think what's confusing to everyone is Help Me Grow is the name for several different things. So first and foremost, so Help Me Grow is really not an entity in and of itself. They're not incorporated. They have a fiscal agent, which is the Educational Service Center. We at the county are their landlords over at Quincy Place. So the staff is over, for the most part, at Quincy Place. So Help Me Grow does the resource and referral for both early intervention and home visiting based for the state. They also are responsible for doing the case management work for early intervention, which is for kids who have an identified delay in disability. So that's part of what they do. They work with the Board of DD on that. We don't have a direct role in that. That's a different system. That's for kids who already, again, have a delay or disability. We're really on the prevention side. So another part of what they do for us, which is discretionary and which is only in our county, is the Bright Beginnings home visiting program. So they do the RFP and contract with agencies to do this program. They run the home visiting collaborative for the county. So there are many home visiting programs in this county. We are rich with resources. So in addition to the state home visiting program and Bright Beginnings, there's the newborn home visit program, which we fund, which is the Nurse Newborn Home Visit. There's the Moms First program from the Department of Health, which we partially fund. There's the BAMS program, which is through COGC for a small number of families. There's the Ohio Infant Mortality Reduction Initiative run by NEON, which is a relatively small number, although with the new first-year Cleveland Medicaid dollars, that's going to really explode. There's the HIPPY program, which CMHA does. There's the new Nurse Family Partnership program, which Metro Health is about to do. So that gives, and I probably have missed, there's the Spark program, which we fund. So we're happy to bring you the matrix to show you all the different eligibility. I mean, it's wonderful, but that's why I'm really happy that what we're able to do in our county is, because we have such a really wonderful central referral site, we can give one phone number to, when I do grand rounds, I don't try to help the physicians understand all this. I go, you got a family who needs services, call this number. They'll figure out, is it early intervention? Is it Moms First? You know, they go through all of that matrix like a decision tree, and they put the family where they match eligibility. And we, by the way, are a model for the state. The state recognizes Cuyahoga County does that kind of central coordination in a way that no other urban community, because the rural communities don't have as much. But I have to show you, I was at a meeting in Columbus where we were discussing state home visiting, or home visiting in general, that the state had done. And the guy from Columbus looked at our matrix and heard about us. He goes, that's just a pipe dream for us in Columbus. So, I mean, I'm really proud of how that central site operates. So I hope that helps.
It does, and that's because of our Health and Human Service levy. We're able to do this. That's what sets us apart. And of course, your expertise and leadership. But, so the number you give would be the Help Me Grow number with the staffing there at Quincy?
Yes.
Yeah, that would be the main place, and they'll coordinate all the different
Yes,
home visiting
and-
service.
Right, and there is a wonderful matrix, so we'd be happy to forward to show you what the collaborative of all these different programs have gotten together recently and wanted, you know, how do we communicate amongst ourselves even to keep track of all this? It's pretty daunting. They put together a wonderful matrix that shows you all of that, and we can send that over.
I would like you, the next time you're here, to maybe give us a matrix presentation.
Oh,
So if
sure.
there's questions, I mean, we need to understand, at least I do,
It's-
fully understand all the players in this. It's not uncomplicated. So that would be great. I don't know if we're going to see you anytime soon, since now we're on a fiscal calendar for this, but
for anything soon?
maybe we'll just
Well, we're
have you
happy
come
to
in.
come- we're
We'll
happy
have
to
you
come
come in.
back.
When the next
Sure.
time we meet, and when there's some time on it, we'll have you, I'd like to hear
Yeah.
that. I hope my colleagues do as well.
Yeah.
Councilman Brown, you had a question?
Yes, last question for me is the number that you mentioned, is that exclusive to physicians, or is that number available to the public? How is the number for Help Me Grow to get through
Oh,
the
it's for
matrix?
everybody.
Okay, can you give it to us? When,
No.
I'm sorry.
Isn't that
Okay.
embarrassing? I don't call that number. We can get it to you.
Okay,
I do know
thank
the
you.
starting point number by heart,
Okay,
but
thank
I
you.
don't call that number.
And
So
then we can leave it to the smartphones. Your smartphones have made us not memorize numbers as much as we should. So.
but it is a relief that you can just say to folks, don't worry, there are all these programs out there. You don't have to figure it out. The family, but you know, you have to go through a whole. Do you live in Cleveland? So immediately that makes. Are you pregnant? What trimester are you in? Right? You know. Okay, you might be eligible for Moms First. You might not be. You know. Oh, you're in the third trimester. Well, maybe we'll send you to Bright Beginnings then, or we'll send. Or if you're outside of the city of Cleveland, you can't go to Moms First. So maybe you go to state home visiting. So it's a whole. I'm telling you, it's. Yeah, and we wonder sometimes why families get confused, right? So.
And this is why the infant mortality rate too has been sluggish. It's just because of all these different pieces that we need to coordinate, I think.
I think we're doing a darn good job, but I think a lot of families we know we aren't serving still. And if we could get to, what would be amazing is to get to scale with the programs that are showing that they're really working, and how we would do that. So, this infusion of Medicaid dollars with First Year Cleveland, programs are really going to have an opportunity to ramp up significantly. And I know the folks who were just here before heard all about that. We're part of that, by the way. So 472,000 of those Medicaid dollars will flow into Invest in Children, and then we'll be coming. Well, we don't have to come. Do we come back here to amend it? No, because it's under 500,000. So we'll be amending the Moms First contract, which is going to allow the agencies they work with to add staff and serve more moms in the city of Cleveland. One of the many things that's going to happen. Fatherhood's getting money inside the county as well, and then the rest of the dollars are to a variety of programs so far outside.
Great. Any questions? So this seems to be something a little bit time sensitive since the contract's effective date is last month. So does anybody object to moving this to the next full council meeting for second reading suspension? Do you want to make a motion?
I make a motion that we move this to the full council again under second
Thank
reading
you.
suspension.
Okay, all in favor? Aye.
Aye.
Any opposed? Okay, thank you very much. This will be on the next council meeting.
Okay. I want just one other thing. So a number of years ago, I was engaged in some research with a colleague on burnout in human service workers, and then we co-authored a book together. And just recently, Child Welfare League, who published the book, decided they were going to go all digital and allowed authors to just get the book for mailing charges. So I have a copy. So I thought if you would like a copy, I thought I have 200 of these now, so I'm giving them out to folks who I think might like.
Is it signed?
No. Yeah, but I don't want to see it on eBay then.
Thank you.
This could be transferred to other areas as well, right?
Well, I do want to say that, but thank you very much.
Thanks so
Nice
much.
to see everybody.
Good to see you. I have no miscellaneous business. Any public comment, Madam Clerk? Okay, so meeting's adjourned. Thanks, everyone.